patient experiences like sodium, we can measure it. It's no different than any other laboratory. So the way we know where we are today in terms of patient experience, at least within the four walls of the medical center. We can do the same for the outpatient experience. We can change. We can initiate some change in practice pattern, and then we remeasure and see what we've done. That's how we improve. I guess when you talk specifically about how do we improve that patient experience, it's a different people have a different expectation. It's a different generation of patients that we treat. It's a digitally focused patient population, and it's an impatient. I don't mean to, no pun intended. It's an impatient group of patients, and that's not a bad thing. It's a good thing. So, how do we focus on access? How do we improve our communication? People expect instant answers. How do we leverage the skills and knowledge and compassion that we as providers have, but also leverage technology so that we can provide that instant communication and still have time for lives outside of medicine? So it's about aligning patient expectations to the service that we can provide. So things like improving wait times, coordinating care, providing better digital access, all of those pieces are areas that I'm focused on. Small pieces, like you come to the emergency room and you wait for potentially hours to be seen based upon the acuity of those who are in front of you or who come in after you. So how simple is it to be screened at the intake desk in our emergency room, and then provide your cell phone number to be called when they're ready to see you, or 5 minutes before they're ready to see you? This isn't novel. Others have done that. We to date have not, and we need to. We should not have an expectation of lower service in medicine than I can get when I make reservations at a local restaurant in terms of expected wait times, or if I show up at a restaurant without a reservation in terms of those wait times. I would much rather have a patient who is, not urgently ill but needs to be seen waiting in the comfort of their home or their car, rather than in a busy waiting room full of others with acute patient needs. I would rather have coordinated care. You shouldn't have to come to Huntington Hospital for a visit and then a blood test and then an x-ray and then back for another visit. That's 4 visits just to know where you are. We are sophisticated enough that we can provide that coordinated care to do it without a person shepherding you through that process. We are sophisticated enough that we can do that in one-stop shopping. We should be sophisticated enough that MRIs don't take 30 minutes and then a 15-minute turnover anymore. These are, again, sophisticated technology that allows us to condense those times and the associated wait times. So I'm a big believer in the Toyota production system of what's value added and what's not value added in medicine. And as we move forward, I think those who are able to eliminate the non-value added time and focus solely on what has value to the patient are those groups that are going to truly succeed.